Guys, so let's talk about intervertebral disc prolapse, Cauda Equina syndrome, and mechanical lower back pain in this video. So firstly about intervertebral disc prolapse. So what happens in this condition is, as you can see here, these are your vertebrae, right? So there is a small prolapse of your vertebrae. So the vertebrae is being bulged out, right? So you can see it here more clearly. This is the vertebrae, right? These are your vertebrae. So this vertebra here is being is being popped up, right? It's bulging outside. So because of that, what happens is the nerves that go through like this, like this, they are being compressed. Because of this bulge, the nerves are being compressed, right? So this nerve, just imagine, this is your body. So these are the vertebrae here, and these are your legs. These are the spinal nerves that are going through, the ones in the blue. And just imagine this green one to be the bulge of the vertebra. So when there is this bulge, this nerve is being compressed, right? So it can be on both the sides, it can be on one side. So usually it's unilateral, right? So when there is this compression, this nerve is being compressed, right? Therefore, there will be problem with this lower limb, all right? So this lower limb might have pain, sensation might be absent, so that it'll present paresthesias and all of that. Unilateral leg pain which radiates through the buttock, thighs, foot and toes. So it will go right from the vertebrae to the buttocks, to the thighs and the legs, the foot and the toes, right? Symptoms can be acute or gradual. It depends on the compression. It depends on the range of the obstruction. So you can see in this image how this vertebra is being, it's kind of prolapsing here. It's kind of bulging out, because of which this nerve here is being compressed, right? So it can either be acute, suddenly, or gradual. Leg pain is more severe than the back pain, because this nerve that is being compressed, it does provide to the back, but it mostly provides to the leg. Therefore, the leg is being affected first, more severely than the back. The patient might also have some back pain, but the leg pain is more specific, associated with numbness and paresthesia, because the sensory also can be affected. Pain usually relieved by lying down. So you can imagine that there is gravity acting here, right? So when you're standing or when you're sitting, there is a lot of pressure being put up on this nerve, right? But when you're sleeping, this vertebrae is going to be relaxed, so it might move up a little, therefore releasing the compression. So the pain is usually relieved by lying down and worsens when walking or prolonged sitting. So you diagnose this condition with an MRI. So as you can see, this here, this is an MRI and it is clearly showing the bulge. So you do an MRI. You don't do an MRI if the patient is presenting with normal pain symptoms. Alright, you do an MRI if the patient is presenting with Cauda Equina syndrome symptoms. So those, you can imagine Cauda equina. This is the Cauda equina, right? So just imagine a nerve being compressed here. So Cauda equina supplies to the gluteal areas, to the groin areas and all of that. So the patient will, there will be compression of the Cauda equina due to herniation, tumor or trauma. It could be anything. Back pain radiating to the legs, it's the same symptoms. Weakness of the leg, sensory disturbances causing paresthesias, and the main thing that we have to know is bowel bladder dysfunction and saddle and perineal anesthesia. So saddle is nothing but anesthesia. Saddle anesthesia is nothing but anesthesia. That is, you're not able to feel your saddle. That is your back muscles. So your gluteal region is going to be anesthetic. All right. And so for this condition, Cauda equina syndrome, you'll need an urgent MRI. All right. So an urgent MRI is needed for Cauda equina syndrome of the patient if there are any red flags such as bowel or bladder dysfunction and saddle anesthesia. The management for intervertebral disc prolapse, it usually resolves spontaneously. Okay, slowly this vertebrae will start coming back to its own place. Okay, but for the pain control, you can give the patient NSAIDs, and for the peripheral neuropathy that is going on, because the patient will have sensory disturbances in his leg, you can give him amitriptyline. And for Cauda equina syndrome, the urgent after the urgent MRI, you give the patient surgical decompression. So you go to a neurosurgeon or an orthopedic surgeon, and you get the patient an urgent surgical decompression. You can also give the patient corticosteroids to reduce the inflammation going on here. Mechanical lower back pain is nothing but mechanical means the lower back pain started due to some kind of work, like the patient has lifted some heavy weights or heavy boxes, and something like that. Okay, some stressor to your back. So the patient presents with benign mechanical lower back pain, that is pain after all of these stressor conditions, and you have ruled out all the other causes like spondylosis, like intervertebral disc prolapse, everything. So next advice is to give the patient some pain relief, painkillers, and he has to maintain normal activities. So bed rest is not recommended in lower back pain. So you give the back some more time to get to adjust to all the work that the patient has been doing. But then avoid sitting so that there is less pressure on your back, and heavy lifting is to be avoided. All right. So that's all about this. Thank you.